It's not often that we list financial instability as a public health emergency. However, that could all change if my next guests have their way, because they believe financial instability is one of the greatest threats to our existence today. And joining me now to discuss all of this is a great panel of guests. Vince Shorb is the CEO of National Financial Educators Council, or NFEC as it's known. Charles Fisher has been involved with anything and everything in the world of entertainment and finance, and now campaigns and community issues related to financial instability. Susan Doty developed the First Responders Finance Program at University of Texas Tyler, and she's going to explain all of that. And Dr. Olafunke Odentunde is a former MD and now a financial coach. She's here to help further our discussion about financial instability. My guests all have great stories, believe me. First, though, to the issues, and thank you all for being here. Vince, let's begin with you. Sort of a several-part question. I've got so much to ask you. I know you've been working like crazy to try and have the U.S. sort of officially declare financial instability really a public health emergency. Certainly, that's an ambitious goal. So why exactly are you doing that? And then secondly, how do you go about getting this sort of declaration? Is it legislative? Is it the activism route? And then with all that said, what the heck is NFEC in your company? The floor is yours, Vince.
Yeah, thanks again for having us. And really, the reason we founded this campaign is there's a direct relationship between people's health and their financial status. This is well documented. If we look at people in the lower socioeconomic status, there's a much higher risk of severe health problems, things like diabetes, obesity, heart disease, which is the leading killer of this country. And that is part of it, right? They're skipping preventative care, skipping medication oftentimes because they can't afford it. Now, our objective is first to mobilize advocates toward this solution. And we're taking a top-down approach. First, addressing this with the Health and Human Service Department, which is responsible for declaring a public health emergency on a federal level. We're also reaching out to each state and 16 of the poorest communities because a PHE or public health emergency can be declared on a local and state level as well. Now, this is really important because our ultimate goal of this is proactive. We want to ensure every child receives a comprehensive financial education, because when you look at financial instability and when problems start, it's in their early financial decisions. Things like getting into credit card debt, buying a car that's too expensive, student loan debt, credit issues. All these things start early. They delay savings and causing extended periods of financial instability that directly impacts their health. We see financial education as preventative health care.
From what I read about your organization, you're kind of trying to teach the world that, as you just mentioned, we must all be financially literate. And I know you're concerned that there's sort of a lack of anything significant in the schools to teach kids the financial world, I guess you can say. So what is this education component, Vince, with all that?
Really, we feel every child deserves a financial education. They deserve the right to know how to earn money and manage their money as it directly impacts their health and well-being. The status of financial education across this country is poor at best. We have the average child receives less than 25 hours of financial education in their entire academic career. Think about that. That's like a little more than 1 day of financial education after 12 years of education. Worse than that, the states that do mandate financial literacy education fail to meet even minimum education standards when compared to core subjects that are taught. And now, since our inception back 19 years ago, we've been active in the advocacy space. I've been personally active very much so in the legislative side of things, and my frustration has grown quite a bit because there's many barriers that are stopping legislation from being truly beneficial to our kids. Things like college admission standards, standardized testing, and powerful forces that do not want this adopted in our school system. So there's major challenges. And as my frustration grew, I started to explore major reforms in our education system. And as I looked at that, the biggest change happened during the COVID era. Now, I'm not advocating they did a good job or anything like that, but what I was impressed with was how quickly forces were mobilized, how quickly teachers, schools, school administrators adopted this new reality. And over a course of, it seemed like a couple days, but it was a couple weeks, made massive changes. And we're trying to leverage this tool, this public health emergency tool that caused the biggest change in our education system since modern education, to ensure our children receive a financial education. So they know how to earn money, how to manage money, and it's subject matter that benefits 100% of our youth in a very meaningful way. I want our kids to gain the skills so they can live a secure and healthy life.
Speaking of that, Charles Fisher, take just a few seconds. You've got an amazing resume. Talk about your background, because certainly your resume parlays into what you're doing today. I know you're involved with several campaigns, obviously trying to help solve all the street violence, which we have a lot of throughout the nation these days. We're witnessing all that unfold. There's the opioid, the drug crisis all throughout our nation's cities. Other community issues, obviously, you advocate for. So talk about your background just for a few seconds, but then more importantly, how money is really sort of at the crux of all this, and how being financially literate can potentially be the solution, Charles.
When I started in 1978, 1.2 million kids dropped out of school, and it's 1.2 million today. So there's been no progress. One thing that we realize is that poverty for us is the root cause. We've seen poor and disadvantaged communities, how they've been affected by poverty. And we felt that in order to really solve gun and gang violence, substance abuse, mental health, obesity, in order to solve those problems, we need to address poverty, which is the root cause. And the only way to address poverty is through financial literacy and entrepreneurship. The problem is there's no school teaching financial literacy and entrepreneurship. So we had to get together and do it ourselves. So in working with the people, Shark, Damon, John, and the Witchard family here at the David and Dinky School for Community Service, we created a financial literacy and entrepreneurship program called the Little Damon Money Club, right? And that money club teaches young people about financial literacy, entrepreneurship, about credit, about how to go out there and create financial independence and generational wealth. And that's the antidote right now. If we want to stop gun violence, if we want to stop substance abuse, if we want to address mental health, we got to hit poverty. Poverty and the lack of financial literacy is a public health crisis. And so we realized that after 47 years. And by working with the Hip Hop and Youth Council and working with schools and housing developments around the country, we've been able to do the research. We've been able to see people grow and develop. But we learned a lot. And working with a guy like Damon John from Shark Tank goes a long way, because he understands financial literacy and entrepreneurship. Being here in a school where you get a chance to educate these kids during the day and after school just as well, and to see how they gravitate toward financial literacy and entrepreneurship, we know we have a winner. So yes, this is a public health crisis.
Susan Doty, you developed, well, it's really a unique education program. It's at UT Tyler, the Tyler campus. It's known, if I'm not mistaken, as the First Responders Finance Program. So you kind of, I guess you could say, created this all based on comments, collaboration, just talking to folks from a diverse group of people I like to term as heroes in our society. You know, the first responders, the police, the cops, the paramedics, nurses, what have you. I guess they all agree that money was a root cause of most of the issues plaguing us today. So talk about that. I know people say money is the root of all evil. In this case, money could be the root of all good, I'm guessing.
We're certainly hoping that is the case. So we're playing with the vocabulary there and taking liberty with first responder finance. We are redefining it for anyone who is working with individuals, families, or communities in financial distress. And so before we launched the program, we didn't launch it from the classroom. We really launched it from a listening standpoint. We talked to our social workers, our teachers, our law enforcement personnel, our healthcare professionals, and each of them told us that the individuals and families and communities that they served were dealing with financial distress. That wasn't a surprise to us. What came as a surprise was that those in the helping professions were facing a lot of the same financial stressors that the communities they served were facing. So credit card debt and, student loan debt and insufficient savings and just the financial stress from living paycheck to paycheck in those helping professions turned out to be a big deal. So what we are doing at the undergraduate and then also professional development and community levels is we are teaching those who are in the helping professions. We are providing them with practical tools, budgeting and saving and credit management and asset protection to not only help them become financially stable, but to put them in the positions where they can share with their clients financial wellness. And so we're seeing a multiplier effect that is very positive as these first responders are able to go into the community and spread the word.
It's interesting you mentioned financial wellness. So Dr. Olafunke Odentunde, you worked in the healthcare industry for years. I'm going to sort of bloviate for just a bit. Give me a moment because I want to hear your story and from you. But it's really a broken healthcare system in massive disrepair. Let's be honest. It's not because of doctors like you who were dedicated, had conviction, really believed in it. But there's a lot of burnout with doctors are having trouble. The medical industry is horrendous these days. I've done tons and tons of stories on this. Ask any patient, they'll tell you the same thing. It's the insane cost. You go to a doctor, you can't afford it. The insurance problems, folks, you can't even pay the monthly premiums. I mean, the insurance premiums are disgusting. Let's be honest. That's what it is. You've got to wait months, doctor, just to get a visit with a general doctor, let alone a specialist, and you got to wait months more sometimes for the test, the MRI, the CAT scan, what have you. And then, you wait all these months, and then you're at the doctor's office, the doctor, they see you for 2 minutes. Some people tell me, well, I've been brushed under the rug. So what I'm saying here is many folks are really neglecting our healthcare system. So with all that said, and you're one of the good people in the business, believe me, but the obvious question, how does financial stability, how does money bridge all this? It used to be in the old days back in the day, we said, I still say today, health is wealth, right? If you're in good health, you can achieve wealth no matter what. But I guess some of you are saying, well, listen, it's kind of wealth is health. What do you say, doctor?
As a physician with more than 40 years practicing, retired family physician, I've had my share of this and I've seen a lot. But one person comes to mind and I want to highlight that because you talked about, the issue of financial instability. You talked about folks that can afford health care and things like that. So one person really comes to mind for me. I remember one of my patients, a hardworking woman in her early 50s. She came to me with complications from diabetes. And when I asked her why she had not been following up with her care, she looked at me with tears in her eyes and said, Doc, I had to choose between buying my insulin and paying my rent. I had to stretch my medications as long as I could. That moment stuck with me. And it's been almost 20 years and I still remember that patient as if it was yesterday because she had the tears in her eyes. And I realized that it wasn't that she didn't understand her condition or motivated to take care of herself because sometimes as doctors, we think patients are just not compliant. But that experience really stuck out to me because I realized that she understood her condition. She also was motivated to take good care of herself. But our actual problem was our financial instability that stood in the way. And what that did was it resulted in multiple visits to the emergency room for her, costing the healthcare system so much money. And I saw that story play over and over and over again. Patients skipping preventive visits, delaying prescriptions, showing up in ER because they couldn't afford the ongoing care. And that was really what led me to understand that there's really a correlation between money and health. And what I understand now as a financial wellness coach and educator is that financial health and physical health are really deeply intertwined, just like you talked about. And financial instability it just doesn't strain the pocket or our wallet, but it actually fuels a lot of the stress that people have. It drives the poor lifestyle choices that people have, and it forces people to actually delay or avoid the care overall. And what this does is really leads to bad outcome for patients and really higher cost for the healthcare system that we're dealing with. So I do believe that we as financial educators and coaches, we can empower our patients and empower clients to manage their money wisely. Just like we doctors teach clients to measure their blood pressure and check their blood pressure, we as financial professionals now can teach our clients and to be able to manage their money wisely. And what that does is really create the conditions where they have better health outcomes and really live healthier life. So I do believe very strongly as a financial educator and a coach now that to have healthier communities, we really must view financial literacy as a public health strategy, because financial stability isn't just about wealth, it's really about wellness. And when we're talking of wellness, we're not just talking of financial wellness, we're talking of overall wellness. And I believe that if people can afford the care themselves, everybody wins at the end of the day. And we can save the healthcare system a lot of money.
So with all that said, panel, back to you, Vince. How then, now that we've established obviously why financial stability is so vitally important, as if we didn't know that, but there are ways to get there more directly. What are the next steps, Vince, to sort of making all this happen where we are all aware, we all have access, we all are engaged to find out what is the best way to learn about all this financial stability and how we do not fall victim, how we don't get into this victimhood mentality, I believe is the way you stated in some of the stuff I was reading about you.
I think all the guests did a great job of relating money issues with really personal impact, right? So it's more than just numbers, what's in their bank account. There's a serious consequences to this, and we're fully committed to making changes. I think the best approach, and the approach we're taking, there's multiple solutions, but the approach we're taking is very proactive. If we can help kids avoid financial problems early on, especially with those early financial decisions, that helps them avoid the challenges of overcoming. Imagine starting a 100-yard meter sprint, 20 yards back. You'd have a very tough time catching up, and that's where our kids are starting today. But through delivering a comprehensive financial education from elementary school integrated into their core subject matter at the high school level, all 4 years, where it's preparing them for near-term life events. So they leave with a resume to get a job, know how to interview, have a budget for moving out on their own, have a plan for education and skill development, and then continued into their college years, especially their undergraduate years when they're serving the majority of students. I think we as a nation would have a very preventative and proactive strategy to addressing this financial instability epidemic. And the unique thing with this is, with most public health emergencies, their focus is getting back to the status quo. If we look at a natural disaster or COVID or any other public health emergency, it's getting back to a baseline where people are okay. The unique thing with this, I believe, is that if we take a long-term approach, we're actually advancing well above where we're at currently. We've never taught financial education at a level in this country that would make a meaningful difference in our kids' lives, and this will be the first time we would do it. And it impacts really every core area of their life. As Charles said with his group, the Hip Hop Summit Council, they're impacting communities on that level, on a community level. Dr. Olufonke mentioned really great ideas about how it's impacting a person, an individual, right? And Susan mentioned great things about how she's empowering healthcare providers to spread this message. And besides schools, I think there's multiple ways we can do it. It takes community members like these to really make a lasting difference.
I'm going to throw something out to the panel, and I hope I say it in sort of a non-clumsy way. My heart is in the right place. This could possibly help a lot of things, some societal ills, and specifically I'm referring to the word racism. It seems that we hear so much about, well, he's a racist, she's a racist, this person's black, this person's white, this person's Jewish, this person's Muslim. I mean, the list goes on and on. There's no shortage of someone telling another person he or she is racist. However, it occurs to me in listening to all of you, Possibly the difference isn't being black or white or Jewish or Muslim or Asian or Latino or whatever the case may be. The common denominator, the common color is green. That seems to be the common denominator. I can tell all of you, I've lived all over the United States. I've lived in very, very poor white areas. I've lived near black communities. I've lived in urban upscale communities because that's where the work took me, whatever the case may be. And it seemed that if you have money in this country, you're okay no matter what color you are. And so it seems to me that just by default, for no other reason, maybe this could help the racism argument. Not to say there's not racism in the United States, we get all that, not to minimize that, but to add to the conversation that maybe it's not about black or white, maybe it's about green. And to you, Charles, what is your opinion on that? And I hope I didn't say that in a very clumsy way.
No, well, poverty has no color. There's a lot of people in red states that are living probably worse poverty here in New York City. And so we have to address poverty, and financial literacy, financial education, entrepreneurship is a way to do it. We just completed a 3-year pilot, huge success. So the Witchard family, Damon John, iHeartMedia, the Fitness Sheriff, we're about to go on the road with a tour. We're going to be taking our program to poor and disadvantaged communities all over America, starting here in New York, because poverty needs an antidote. The antidote is financial literacy. So we can approach the mayor, the governor, Surgeon General, RFK Jr., whoever, and get them to understand that gun violence is a public health crisis. But the lack of financial literacy is just as bad. If we can feed families, take care of food insecurities, deal with academic failure, if the lights are off, kid can't read, that's poverty, right? If there's an eviction, that's poverty, can't go to school. You don't have the clothes, poverty, sneakers. If we address poverty, we can solve all the social ills that we have. So now that this pilot is complete, we're going to take this on the road, and we want governors and mayors to declare the lack of financial literacy a public health crisis. But you got to go on the road, and we know that's the antidote. And we want to thank your network for shining the light on the dark.
And it's going to be a road well traveled, I know. Susan, your opinion about all of that, green being the overriding color in the United States. If you got green, it seems like, well, you're a little bit better off, obviously.
What we're trying to accomplish is to see the tide rise for everyone. We are all better off when any of us are better off. And I think that what we're trying to do is to break down silos, and not the silos that you're talking about. We're thinking about university silos where our disciplines are often kept so separate, but financial wellness and what we're doing here at UT Tyler is we are breaking down those barriers between, College of Medicine and arts and sciences and business and engineering. We are bringing students in all majors and all professions who are seeing the potential for their own lives and for the people in their communities in all of their helping ways.
Doctor, you get the final word on this. Why is this financial literacy of such vital importance for all of us?
Dollar is green. Green is green for everybody, irrespective of our race. And I do believe very strongly that when people are financially empowered, a lot of the ills that we have around really, most of them will disappear. A lot of some of the things that we have, people just want to be able to survive. They want to be able to put food on their table. They want to be able to live healthy life. They want to be able to afford medical care or afford just the basic necessities of life. And that green doesn't really matter. I mean, it doesn't matter who is holding that green. Green is green. You're going to buy the same thing everywhere. So I do believe that, if we empower everybody, irrespective of what race that we belong to or the social stratus or whatever, a lot of the ills that we're dealing with, whether it's drug use, whether it's alcohol use. I mean, there's so many ills, whether it's gun violence, whether it's truancy in schools, whether it's poor health. I mean, there are just so many things that we can I do believe very strongly that can be resolved just by getting people financially empowered. Not just getting them the money. A lot of people know how to earn money, but not everybody knows how to keep and grow that money. That's part of financial literacy. So where folks go to colleges, whether it's even medical school, I'm always telling even healthcare professionals, doctors included, we're trained to earn money, but we're not trained how to keep the money. So it's important that we're not just introducing it very early in elementary schools. I do believe I'm one of those that believe that you need to introduce it even in elementary school. We don't need to wait until they're medical school. So the earlier we introduce it, people get financially literate, they can manage money. So when they start earning money, they know how to keep the money and grow the money. So yes, I believe very strongly in financial literacy. That's why I'm doing it now. So yeah.
Well, thank you all so much. Vince Shorb, Charles Fisher, Susan Doty, and Dr. Odentunde.